Every child has a dream that someday they will grow up to be something. I had that dream when I was about 10 years old, that I wanted to be on the radio. I would listen to the radio and I thought, this is really cool to be on the other side of that. And that dream came true for me when I was featured on, as you saw, Canada's most unique radio talk show called The Bill and Bill Show, where I was known as the tone arm. And if you're too young to remember that, Google it. Where I featured music on the show, and it turned out I was the first broadcaster in history to use music to enhance a radio talk show. I since went on to host my own radio talk show called Life Talk, which turned out to be Edmonton's most interactive radio talk show. I've also hosted a show called Edmonton This Week on 630 CHED, and I've hosted a television show which was Edmonton's only live interactive television show called Edmonton Live. And over a 30-plus career, I am known as one of the best interviewers in the business because I've had a chance to interview some of the biggest celebrities and newsmakers in the world. And when you look at a career like that from the outside, you would think the guy was very successful, which is true. I have accomplished a lot in that career. But do you really know what's going on the inside of someone's life, inside the walls of someone's life? You see, things are not always what they seem. For example, 500,000 Canadians will miss work tomorrow. Why is that? Mental illness. It's the leading cause of workplace disability in Canada. Depression is the #1 cost to healthcare worldwide. And 20 to 30% of Canadians will experience a mental illness in their lifetime. 20 to 30% of the population. That's a profound impact. When you think about that, that means that every single family in Canada is affected. No longer can we say, not my father, not my mother, not my brother, not my uncle, not my cousin. Every single family in Canada is affected. So the impact is significant. But yet, we don't hear regular reminders to check our mental health. We hear reminders to check our blood pressure, for women to get breast cancer screening, for men to check our prostate, even reminders to check the batteries in our smoke detectors, the air in our tires. Those are all important. But why not regular reminders to check your mental health? Today I'll be talking about two of the most common mental health illnesses, and that's anxiety and depression. There are others, but those are the most common. When you think of the stats, mental illness can affect anyone at any time and cuts across all age, racial, religious, or socioeconomic categories. As you see from the picture, women are twice as likely to experience anxiety and depression than men. Men, we tend to suffer in silence and not report symptoms, possible contributing factor to men's higher rates of alcohol abuse and suicide. And research indicates the onset of anxiety and depression occurs earlier now in children than in past decades. And further facts, studies have shown a clear link between mental illness and addictions. It's now referred to as mental health and addictions. And mental illness is a contributing factor to the alarming rates of suicide. So I've heard it said this way: if you have a brain, it could happen to you. If you have a brain, it could happen to you. So the question is, how is your mental health? How is your mental health? Do you think about it? Is it something that you are aware of? The stressors in your life that could cause mental health issues? So let's look at that. How are you handling stress in your life? Maybe not very well. As a society, we're pretty stressed. In 2010, Statistics Canada did a survey, and 23.5% of Canadians aged 15 and older reported that most days were extremely or quite a bit stressful. Most days, and extremely and quite a bit, not just some days, and not a little bit, but most days extremely or quite a bit stressful. That, my friends, is considered to be chronic stress. The acute stress that comes into our life, you should be able to handle. You can't live a stress-free life. There's always going to be things that are going to cause a bit of stress in your life. But when it gets to chronic stress, which is a state of prolonged tension from internal or external stressors that may cause various physical, emotional, or mental manifestations. That's chronic stress. So when we look at the emotional and mental effects of chronic stress, they are feelings of irritability, moodiness, or depression, confusion, loss of sense of humor, anxiety, anger, irritability, and fear. Those are the emotional and mental effects of chronic stress. So there are physical health effects of chronic stress, and that includes heart disease, increased risk of heart attack and stroke, high blood pressure, ulcers, some types of bowel disease, and damage to the immune system. Those are the physical effects of chronic stress. Now, not all stress is bad. Is there such a thing as good stress? Yes, there is. It's like not all situations that are labeled stressful are negative, like a wedding, changing jobs, birth of a child, buying a new home. Those are all positive things in your life. That could cause a little bit of stress, but it's not going to really cause you any harm because those are things that you're looking forward to. So some situations in life are stress-provoking, but it's our thoughts that determines whether they are a problem to us. So it all comes down to what we are thinking when those stressors come into our life. And how we perceive a stress-provoking event and how we react to it determines its impact on our health. So the conventional wisdom is this: unchecked acute stress can become chronic stress, and chronic stress can lead to a mental disorder. You see, I am a lifelong sufferer of mental illness. It's a miracle that I am alive today. I could have easily become a drug addict, an alcoholic, or a suicide statistic. I've experienced 5 mental breakdowns in a 20-year period. In 1991, after 10 years of being on Canada's most unique radio talk show, known as the Tone Arm, came crashing down in 1991 when there were cutbacks to radio, and I was let go. And it devastated me. My childhood dream had come to an end. And I started to sink deeper and deeper into, I never labeled it a depression, but I just knew I wasn't doing well. And other people noticed that I wasn't doing well. So I began to sink emotionally deeper and deeper, became paralyzed with worry and fear. And a friend encouraged me to see my doctor. And I said, there is no way I'm going to my doctor because of this. I did not want to be labeled. I did not want to have people think that I couldn't handle this on my own, that I was weak. So I fought it. I didn't want people to say, he's crazy, he's going to his doctor for some mental issue. And I just didn't want to have that label. But reluctantly, I did go because my friend kept encouraging me to go. And I was diagnosed with generalized anxiety disorder and depression. It's very common to have more than one disorder. I actually have more than one myself: generalized anxiety disorder, depression, seasonal affective disorder, which means I could tend to worry about things I can't control, like the weather, social anxiety disorder, whereas if I'm in a group of people, that, especially people I don't know, but even people I do know, I can get high anxiety, obsessive compulsive disorder, ADHD, So that's about 6 mental disorders. But the good news for the single women of the world is that I'm available. No, really, there's a sign-up sheet at the side here. But you know what? That's my life. That's what I have. And I'm okay with it because as you'll see soon that when you get the right treatment, you can survive, and not just survive, you can thrive with any mental disorder. So let's look at what is generalized anxiety disorder. It's the most common anxiety disorder. People with GAD worry excessively and uncontrollably about daily life events and activities. This high-level anxiety makes normal life difficult and relaxation impossible. GAD causes a significant disruption in a person's life. People with GAD may develop other disorders such as panic disorder or depression. Like I said, very common to have more than one disorder. And substance abuse or dependence may also become a problem with generalized anxiety disorder. So kind of put it in perspective, this is a major worry ward. This is someone who tends to worry about everything, and usually the worst case scenario. So what are some of the psychological symptoms of generalized anxiety disorder? Let's look at them. Irritability, feelings of dread, inability to control anxious thoughts, edginess or restlessness, inability to relax, difficulty sleeping and concentrating, fear of losing control or being rejected. Those are the psychological symptoms of generalized anxiety disorder. With mental illness, it's also a physical disease. So the physical symptoms of GAD include muscle tension, aches or soreness, stomach problems, nausea, diarrhea, jumpiness or unsteadiness, fatigue, shakiness, sweating, headaches. Those are the physical symptoms of GAD. So the question is, how do you know if you're worrying too much? How do you know if you're worrying too much? Well, if your worrying significantly disrupts your job, activities, or your social life, if your worrying is uncontrollable, you just can't get control of those worry thoughts, your worries are extremely upsetting and stressful, you worry about all sorts of things and tend to expect the worst, you've been worrying more days than not for at least 6 months. That's what the doctor will look at, a 6-month period, and say, have you been worrying more or less than that 6-month period? So it's just, your worrying is just so uncontrollable. But the thing about worry is, it's a total waste of time. It doesn't change anything. All it does is steal your joy and keeps you busy doing nothing. That's what worry is. So let's look at depression. We all use the word, oh, I'm so depressed. It's Monday morning, I have to go to work, I'm so depressed. If your favorite hockey team is not doing well, you say, oh, it's so depressing, they can't win a game. But what is true depression, clinical depression? It's the most common mood disorder. It's a whole body illness involving your body, your mood, and your thoughts. It affects how you feel, think, and behave. And it's not just a temporary mood swing or a sign of personal weakness. It's a serious medical condition with many emotional, cognitive, physical, and behavioral symptoms that affect a person's life, lasting at least 2 weeks. That's what the doctor will look at, a 2-week period of being in this clinical depression. Now, when I reluctantly went to my doctor in 1991 and was diagnosed with GAD and depression, and I've been to my doctor many times for many things, I noticed a poster on the wall that I'd never noticed before. And it simply was an acronym to describe the symptoms of depression. And it was SADdy faces. SADdy faces. Let's break it down. The S is sleep. You see, when you have a mental illness, you can either sleep too much or you can't sleep at all. So a change in your sleep pattern, that's the S. The A is for appetite. Either a decrease or an increase in appetite. Depressed mood, Loss of interest. The I is interest, loss of interest. And this is a key one for mostly people who are observing someone who may be going through a depression. And you notice that, every Friday night you used to get together with the guys or the girls, and all of a sudden, one person isn't coming anymore after years of doing this. They've just lost interest. There may be something to that to check into. That's a key. F is for fatigue. You just have no energy. A is for anxiety or agitation. C is for concentration, difficulty concentrating. E is for esteem, feelings of worthlessness. And of course, S is for suicidal thoughts. Saddy faces. Now, when we talk about the stressors in life and how we react to them, there's something out there now that has been there for a number of years, but only now it's becoming a real issue, and the medical community is looking at it, and that's social media and how it affects our mental health. And studies now show that social media can actually make you feel sad, depressed, and anxious. According to studies, the more people checked Facebook, the worse they felt about their lives, especially if they spent time viewing vacation photographs of other people. It's true. Studies have looked at that. Studies show that a person's self-esteem suffers when they scroll through friends' feeds and view perfected images and ideal personalities and traits. Perfect people out there on social media. That virtual world is like a virtual perfection. Every picture looks perfect, every post is perfect, every vacation is perfect, all the kids that these families have, they're perfect. And it brings you down. There's extreme pressure to achieve the perfect selfie. There's even tutorials online to tell you how to take the perfect selfie. And now we have selfie sticks because our arms are not long enough to take a selfie, which used to be just a selfie of yourself. Now the selfie is 2, 3, and a whole group. That's a groupie. That's not a selfie. So now we have the stick to go further, to get even more people in this selfie. Pretty soon, my prediction, and you can mark it down, and it's on tape, eventually we'll go back to just saying, excuse me, can you take our picture? How long do these polls have to be? They're banned in a lot of museums. They're banned at Disneyland because people were taking them on the rides. That's a bit dangerous. That's called jousting. Didn't we learn anything from that period? So yes, that's what's happening. Self-esteem, pressure, perfect selfie. Get the amount of likes you want. You post something, and then you wait, and you check. How many likes? You want lots, you get 2. That brings you down. Or you get no comments on that perfect selfie that you just spent hours, doing yourself up, getting the right angle. It's all about the angle, so you don't get all the chins, right? And so it's all about the angle, it's all about everything. Look, and you do that, and nobody likes it, nobody comments on it. That affects your self-esteem. These are studies that show this is happening. So it becomes an anxiety-inducing quest for likes and comments. You're pretty much putting yourself out there to be critiqued by all your friends. You see, when Facebook started, I questioned that word friends. You have 400 friends. Are they really your friends? If you really want to know who your true friends are, post that you're moving this weekend. And you have 3 sofa beds, and see how many friends will help you. I have a better word. It should be stalker. Think about it. What do we do when we go on Facebook? We're stalking people. We want to know what they're doing, who they're doing it with, where they're going. What are they eating at the restaurant? Because they're taking pictures of their plate of food. Why? Why? If I want to see a plate of food in a restaurant, I'll go to the restaurant and open the menu. But this is what's happening. People are posting things. And it becomes more of a journal for people. And I question, why are people willing to share so much about themselves? What do they want in return? And I talk to a lot of youth on this topic, and I tell them, before you go online, ask yourself this question: what's motivating you to go online? Are you feeling low and you need a pick-me-up? You're not going to get it in the virtual world, but that's what's happening, because the studies have shown that you actually feel worse. Because when teens who do not receive the amount of likes or positive comments they expect will feel anxious, sad, depressed, and experience low self-esteem. That's been proven through many tests. So the mental health effects of social media on all ages are now being seriously looked at by the medical community, which could identify the next anxiety disorder, and it is called social media anxiety disorder. SMAD. SMAD. Social media anxiety disorder, or SMAD, is a syndrome that relates to generalized social anxiety, which is what I have, generalized anxiety disorder, and is acquired when the participation of social media affects the mental and physical well-being of an individual. So what are the symptoms? And this may make you cringe when you read this, because you may see yourself experiencing this. So here are the social media anxiety disorder's symptoms. Feeling a sense of attachment to your phone or computer as if nothing else matters. How many times have you driven to work and you're like 2 minutes from work and you realize, I left my phone at home? Do you just go to work and just go that day without using your phone? No, chances are you'll turn around and go get your phone. That sense of attachment. Frequently checking the number of followers or likes and comments on social networking sites, and constantly finding opportunities to increase response, to get more of those likes, more of those comments, and built up anxiety when you don't receive an expected amount of likes or comments. So when you look at social media, the effects on your mental health: clingy behavior, always seeking to please people. You're putting stuff out there to try to please people, to get those comments. Extreme loneliness, low self-esteem, body image issues, dysfunctional families, mistaking the virtual world for the real world. So when you think about it, social media is not so social. It's actually unsocial. Because when you think about it as well, social media usually leads to isolation. People think they're connected, but they're really not. They're isolated, alone with their computer or their device. Isolation. And one of the worst things for mental disorders is isolation. So that isolation could turn into a mental disorder. So what about normal versus disorder? How do you know if you're normal or maybe you're leaning towards the disorder spectrum? Well, anxiety is normal. Every little bit of anxiety is normal. It keeps you sharp if you're driving on slippery winter roads. If you have a test coming up, you have that little bit of anxiety. That's a reminder to study for the test. So a little bit of anxiety is fine. But if that pendulum swings too far one way and it's paralyzing you and you can't function, you can't think, that's an issue. Same with depression. Mood swings are normal. Not everyone can function without having any kind of mood swing. So a little bit of a mood swing because something terrible happens in your life, that's normal. So what is the rule of thumb on this? If your thoughts, feelings, or behaviors are significantly impairing your daily life, it may be time to seek help. It's that simple. If you had any other illness or an injury to your body, and you couldn't get to work, you can't walk, whatever, you have a broken leg, it's time to seek help. So you do the same with mental illness. Now, the thing about the stigma attached to mental illness is that people think they have to go right to a psychiatrist. Oh, I don't want my friends to know I have to go to a shrink. That's not the case. You go to, like I did, your doctor, your family doctor. That's the place to start. He's seen you on a number of different occasions, on a number of things, so that's where you start. You don't automatically go to a psychiatrist. They are there as a referral if you need medication. If you need to talk about your issues and have someone work through the issues, there's psychologists or clinical social workers or mental health therapists. Those are people that work through the issues. So you don't go directly to a psychiatrist. I did go because I needed medication. But we have this image of the psychiatrist, it's this white building with the white room, and you walk in and there's a couch, and you lay on the couch like on the TV shows and the movies. It's not like that. The first time I went to my psychiatrist, I walked in the room and I'm looking around, and she says, "Is everything okay?" And I said, "Yeah, where's your couch?" She says, "Wade, that's in the movies. Have a seat." So I laid on the floor. It's not like that. You see, we've got to get rid of those perceptions that we see in Hollywood. That's not the case. It's like any other illness. You get help when you have the issue. So the treatment is simple too. The treatment for anxiety and depression is there's therapy, as I mentioned. People help you walk through the issues in your life. There's medication if you need it, or a combination. Sometimes a combination is good as well. Sometimes, some people just need that medication to give that little bit of lift in the morning to get them out of bed, and then the therapy helps them through the issues that they're dealing with. And one of the big therapies is called cognitive behavioral therapy. Cognitive behavioral therapy. What is that? Well, CBT, it's a type of therapy that helps patients to understand the thoughts and feelings that influence behaviors. And this is not just think happy thoughts and you'll get over this. No, this is getting really to the root cause of those negative thoughts and how to turn those thoughts around and how to identify what triggers your thought patterns. That's what CBT is. So it helps in the following areas: changing errors in thinking, reducing negative thoughts, increasing pleasurable activities, improving assertiveness and problem-solving skills, reducing feelings of hopelessness and despair. That's what it helps. But it's important to seek help as soon as possible because untreated mental health issues will affect your physical health. Research shows that poor mental health equals poor physical health. The Canadian Journal of Psychiatry published a study reporting that a person with a mental health diagnosis, that's me, had a 70% increase in mortality. Think about that, 70% increase in mortality. And I know what you're thinking, and I thought this too. It's not just by death by suicide. It's diabetes, it's cancer, it's heart disease. That's how serious untreated mental illness can be. So let me take you back to 1991 when I sought help. After 10 months of unemployment and being on medication and going through therapy, I finally got a job again. And I went off the medication, thinking I didn't need it anymore. Because all is well now, I was employed. 1995, 4 years later, another mental breakdown due to job loss. Back on medication. But as soon as I got a job, I went off the medication thinking everything was okay again. 2002, 7 years later, another breakdown due to job loss, back on medication, then off again after getting a job. 2007, 5 years later, another breakdown due to job loss, did therapy for a year, then stopped, thinking I didn't need it anymore and started using the busyness of work as a distraction. Notice the trend? This guy can't keep a job. Oh, the other trend, I kept wanting to get off the medication because once I started feeling better, I thought, I don't need this anymore. But it was the medication and the treatment that was causing me to feel better. But I also wanted to get off because I wanted to be normal. I wanted to be normal. I have since learned that my normal, and your normal, and your normal, and your normal are all different. There is no such thing as normal. Some people have to take pills for other reasons. Some people have to take injections. Some people have to do this, change this, do that, eat this, don't eat that, all that kind of stuff. That's their normal. But I want it to be normal. And I realize now my normal is I take medication for what I'm dealing with. And I continue with a therapy program. So 2010, 3 years later, another breakdown due to job loss. This time, the worst of them all. You see, they always got worse as I went along. And a lot of people ask me, what does a mental breakdown look like? And it's hard to explain except to say that if I was plugged in and somebody just unplugged me, I had nothing. I had nothing left. In 2010, I was lying on the floor in our basement, and my wife at the time came downstairs and said, "Are you okay?" And I said, "No, I cannot do this anymore. I cannot hide this anymore." So immediately, I went to the emergency room at the hospital and was immediately put under psychiatric care and into an intensive 4-month psychiatric care outpatient program to deal with my issues. And I was with 10 other people who have hit rock bottom as well. And it's unfortunate that some people have to hit rock bottom before they seek help. I'm a pretty stubborn person, and I had to hit rock bottom before I sought help. So I'm in a room for 4 months, just about every day of the week, with these people who, many of them, tried to take their own lives many times. So like-minded people. So I hit rock bottom. I couldn't function anymore, couldn't hide anymore. But I did realize I needed help. Couldn't do it on my own. I wasn't functioning. I knew that. So I went into this program. But I said to myself that if this doesn't work and my life doesn't start to turn around, because I was in a lot of pain from those 5 mental breakdowns in a 20-year period, was just chipping away at me mentally and physically. I was in a lot of mental and physical pain. I said to myself, if this doesn't turn around very quickly, you see, I'm a type A personality. I like things to be pretty quick. I want to see results. And I said to myself, if I don't see results, I'm going to take my life. I'm going to check out. So I started planning my own death, which was going to be a few months down the road. But thankfully, through the intense group therapy, as well as a medication strategy under psychiatric care, my thoughts started turning towards living instead of dying. I started to think about the ripple effect of death and who that would affect. You see, when you're in that much pain, you don't think about that. But I started to think about that I have 3 grandchildren now. I wouldn't have known 2 of them. And they are such a joy in my life. So that's where my thought patterns went. And then I started to think about the ripple effect of life, that how we affect each other and how I can encourage other people with my story. So I wasn't planning my death anymore. I started thinking about life and what I was going to do to help other people who were in the same situation as me. You see, untreated mental health keeps you from truly enjoying life. I have been robbed of so much joy in my life. So much joy I've been robbed of because of untreated mental illness. Admitting I had a problem and seeking help was hard, but it was the best decision I ever made for myself and my family. The tendency is to want to be alone in our suffering and not to burden others. The truth is that others care and want to help and encourage friends to get better. But when you're in that dark place, you think you don't want to burden other people. But the truth is they want to help. We need to reach out and be honest with our friends and our healthcare providers about our feelings and emotions so we can receive the right treatment to get back on track. The earlier that happens, the better. You see, I realize now that I've suffered from this disorder all my life. I did not receive the treatment I needed at an early age. I came from a broken home. My parents divorced when I was 6. I was the youngest of 4 in the family. It divided the family, caused lots of tension. A lot of my siblings went one way and others went the other way. My mother had her own personal issues and limitations. There were a lot of control issues and anger issues that led to emotional and physical abuse and abandonment. Growing up, I lacked love and affection and acceptance from my parents. I didn't have those strong, positive role models. Like any other child, I needed guidance and nurturing, but unfortunately, it was lacking to the point where I started to become very hyper and very anxious and fearful about everything, not knowing how to control my emotions. You see, I needed someone to say, "Don't worry, Wade, it's going to be okay." I never heard those words growing up. I also never heard the words, "I love you." And I never felt a nurturing hug from a parent. I was emotionally abandoned as a child and never experienced that. Can you imagine a child not hearing, "I love you, don't worry, it'll be okay," and having that reassurance in a physical hug? The world became a very scary place for this child, well into his teens, into adulthood. It lasted a long time, and I'm still feeling the effects of it because it wasn't there when I needed it. I experienced many anxiety-induced panic attacks as a child, which continued into my teen years and my adult years. Because of anxiety and depression, I lived in fear, with out-of-control worries all my life, never at peace, always fearing the worst, and never fully enjoying life at any given moment. Never living in the moment and enjoying life in the moment, because my thoughts were always taking me to worries about the future, feeling sad about the past. So you may wonder, how was I able to perform on radio and put myself out there in the public every day for over 30 years while suffering from a mental illness? I can tell you, it was very, very hard, because you're trying to hide something that is just bringing you down, and I had to perform. I was exhausted all the time. My wife at the time could not listen to me on the radio because she could not relate to that person. That was not me. She knew the real me at home. So I was putting it on. It wasn't easy. I tried to act normal. From the outside, everything looked fine. But people who have anxiety and depression utilize a lot of energy just to cope. And I had to take it to a level of entertainment. You become mentally and physically drained by trying to do normal everyday tasks when you don't even have the mental or physical strength. Just getting out of bed becomes a huge task. So I was exhausted all the time. Radio was my addiction. Radio was my addiction. I used it to try to ease my pain. You get to do a lot of cool things in radio. You saw some of the pictures there. You get to hang out with Betty White and Bob Barker and hang out with the cast of MASH, my favorite show at the time. That's pretty cool. So I was like into that all the time. And every time there was a place to go and our program director said, "Who wants to go on this trip or do this and go meet?" I'd be right there. I was addicted to radio. And I realize now I got into radio because I needed that affirmation from strangers that I didn't get from my own parents. I had a big hole inside of me. So I go and be the tone arm, and I go and be that radio person that people want to meet, and they say they love me and what a great show you do, and I love what you do and everything. But it's superficial. I was trying to get them to fill that hole, and it wasn't happening. It wasn't happening. But there are many people who look fine from the outside. Comedians, for example. A comedian telling jokes to ease their pain, hiding behind their jokes, receiving laughter and acceptance from an audience, but really suffering from the inside. And that really came to the forefront with Robin Williams. Perfect example. And many comedians are aware that they have mental health issues, but they are afraid to get help because they think that is what gives them their comedic edge. They're afraid to go on medication to calm them down a bit. They're afraid to get help thinking they won't be as funny. And there's many comedians who are afraid to get actual treatment to help them deal with it better because they're afraid they won't be funny anymore. But the truth is, you function better when you are healthy. See, untreated mental illness causes difficulties in all areas of life. It can ruin relationships, marriages, careers. It can ultimately ruin a life or end a life. For example, suicide facts. Untreated mental illness can ultimately end in death by suicide. Suicide occurs across all age, economic, social, and ethnic boundaries. Suicide is the second leading cause of death among young people aged 15 to 24. But the truth is, suicide is preventable. Most people who attempt suicide want to live, but are overcome with emotional pain and see no other option. You see, suicide is not about death. It's about ending pain. Most people who contemplate or attempt suicide want to live, but are overcome with emotional pain and cannot see any other way to handle a situation that may seem overwhelming and impossible to bear. See, people who die by suicide don't want to end their lives, they want to end their pain. But the truth is, suicide doesn't end pain. It passes it on to others. It passes it on to others. So I believe it's a time to break the silence and end the stigma surrounding mental illness. We need to break the silence and the stigma so everyone can get the treatment they need without fear of discrimination. Statistics have shown that over 60% of people suffering from a mental illness do not seek help, mainly due to the stigma. Mental illness stigma is labeling people for what they've been diagnosed with rather than the person that they are. Would we do that with any other disease or illness? Would we do that to a cancer patient? No. But just because we can't see it doesn't mean it gives us the right to discriminate against it. See, people see mental illness as a weakness instead of an illness. It's not called mental weakness, it's a mental illness. So it's time to treat mental illness like any other illness. And like any other illness, if mental illness goes untreated, it can be fatal. Now, while there's still some progress, we have seen some progress in this area. Having a mental disorder can still cause discrimination based on fear, misunderstanding, or just plain ignorance. But I believe the more the stigma is broken, the more lives will be saved because people will seek help without fear of discrimination. It's that simple. But we as a society need to talk openly and honestly about our emotions so that the people who are suffering in silence will feel comfortable to step forward. So when we start doing that, then people start believing what I call the 5 basic truths about mental illness. Truth number 1, mental illness is not a character weakness. Truth number 2, it's not your fault. And maybe people in this auditorium or people watching this DVD right now, you need to hear this. Or maybe you need to say this to someone else who is suffering. Truth number 3, you are not alone. You heard the statistics. Truth number 4, mental illness is treatable. I'm a walking example of that. And truth number 5, there is hope. You think that there is no hope when you're in that place of darkness, and I was there, but there is hope. Hang on, pain ends. That's hope. The bottom line is, there is no health without mental health. Because I chose life, I'm now able to encourage others to do the same. We can survive, we can even thrive with mental illness. But we need to keep talking openly and honestly about our mental health. And if you're struggling, don't try to handle it yourself. It may get worse. Seek help if needed. Encourage others to seek help. We can all break the silence and end the stigma about mental illness. You see, it starts with information. As soon as you have the proper information, that leads to hope. And hope will lead to action. But it all starts with you and with me. Let's keep the conversation going. Thank you, God bless, and good health.